Good morning and welcome to the JMCSS podcast for the district. I'm Greg Hammond, Chief of Public Information for the Jackson-Madison County School System. This morning we will focus on health and wellness, plus the return of our school system's school health clinic. We'll visit with Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and Latreace Brown with West Tennessee Medical Group. First, a reminder for the district, the JMCSS podcast is a production of the Jackson-Madison County School System in partnership with Forever Communications. You can listen to this episode on demand on Apple iTunes, Google Podcasts, Spotify, or wherever you listen to your favorite podcasts. Ladies, thank you so much for being here and welcome to For the District.
Thank you for having us.
Now, I know you all work in healthcare, but I have to start the way I start all my shows, by asking my guests if they always knew what they wanted to do. So I'll start with you, Annette. You and I kind of took a back door into education, so let me ask you, did you always know you wanted to work in healthcare?
Yes. Yeah. From a very early age, I knew that I wanted to work in healthcare, and so that's how I started. And then as I started working with more children, I really got interested in working in education. So education and healthcare are totally two different worlds, totally. But they do have some similarities. And so I've really enjoyed the last many years of my career being in education.
Now, Annette, you've been with the Jackson-Madison County School System since...
I have been in school health working with Jackson-Madison County Schools for about 23 years.
You got me beat. Latreace Brown is a clinic manager with West Tennessee Medical Group, and I've learned since meeting Latreace that you already oversee 2 school health clinics in other counties. Mm-hmm. So Jackson-Madison County will be the 3rd school health clinic. Well, let me ask you, because there are always families who listen, and there are students who listen, and it's good for students to hear that, number one, it's good to have a plan, but number 2, if you don't, it's still okay. Mm-hmm. Latreace, did you always know you wanted to work in healthcare?
Yes, of course I did. I love helping others, and the education piece just came over time.
Now, big news for Jackson-Madison County Schools. Our school health clinic is reopening.
Yes.
And as a employee and former classroom teacher, I can tell you this is important. I remember, I guess particularly it was maybe 2018, that in the middle of teaching, I just didn't feel well. And so working with the principal to, get out of there and go to the clinic, that reminded me, Greg, you can go to the school health clinic so you don't have to wait. Mm-hmm. And so it was a major blessing to have that piece there, really that support piece for our employees. Annette, give us a little history about the school health clinic. And looking in my notes, it was first established back in 2009. Is that correct?
Yes, in 2009 was when we opened in October and served our students and staff very well for 11 years. And then in 2020, everybody knows our world changed forever. We're slowly getting back to some normalcy, but the clinic closed. It was difficult. We struggled in the world of education to figure out how are we going to educate our kids, much less in the middle of, in healthcare, trying to figure out how are we going to treat our patients. So the decision was to close our clinic, and but I always had that on my bucket list to get that clinic back open, and so the first time we met early on in July probably, or the 1st of August, with West Tennessee Healthcare and West Tennessee Medical Group, they said, what can we do? We have a lot of partnerships with West Tennessee Healthcare, and I said, I really want the clinic back. Our students need that clinic, and our staff, as you said. And so Lindsay Randolph, who's the director of that portion that works with the clinics, she said, how can we make that happen? So we sat down with Dr. Williams and Dr. Catlett, and it's happening. It is happening, and I'm so excited.
Annette Wilson is the school coordinated Health Administrator for Jackson-Madison County Schools. Latreace Brown is our new community partner, as she is the Clinic Manager with West Tennessee Medical Group. Latreace, put into words what benefit a school health clinic provides a community.
That's easy. It provides the opportunity for a child who's unable to go to the doctor, whether it be, through parents being unable to take them, transportation issues. With that school clinic there, if the child is just a minor sickness, they can go in and see the nurse practitioner and go back to class. But if it's something that, needs additional attention or need referrals, we also can refer out within the community. So, yes, it'll be a great thing for the community.
Now, I know the reopened school health clinic may look a little different than the one that was first established, but Latreace, provide us just with some general context, services that most school health clinics offer.
Okay,
typical
so
services that parents may be interested to know.
Okay, so they can be seen for a simple cold, sore throat, flu, a wellness, a sports physical, all those things that are needed yearly that sometimes, with our busy schedules, we don't always have time for. So with the school clinic being open for that reason, that gives you more opportunity, more choices, and it's convenient because it's there in the school. And not only is it for the JCT students, but it's for the community, all the students of Jackson-Madison County.
Annette, so many of our employees are just going. They just go. They're wanting to get the job done. But this service reminds us to slow down and take care of ourselves. Right. Talk about the benefits that it offers employees in terms of just general health.
Well, I think one thing is we need our teachers and our students in the classroom. We know that. And so having the clinic is able to provide a service that's timely. We can get students and staff seen quickly, and if they are not contagious, return them back to class. So that's huge. They don't have to sit and wait for hours waiting to see a provider. But I think one of the biggest things, too, is not only for our staff, but they can bring their children there. And so many of our staff, in the years past when we were open, their child wake up and maybe not feeling well, and they can get them in first thing that morning. And if the child can go on to school, then the parent can go on to work and teach or work in the cafeteria or whatever their role is within education. So that's proven to be very helpful. The other thing, too, is being able to get, for staff and students, their immunizations that are recommended. Even as an adult, there are flu shots and things that we need, or
tetanus shot.
Yeah, tetanus shot.
If you're a fisherman and you hook yourself, you need to make sure your shots are up to date.
That's right. So, there's a benefit there as well. I just think that the access to health care is huge for the students and the staff, and being able to access it in a timely manner.
If you're just now joining us, we're visiting with Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and Latreace Brown. She's the Clinic Manager with West Tennessee Medical Group, and we're excited because our school health clinic is set to reopen in July.
Yes.
This was after closing down in 2020. Now, the clinic will be open 2 weeks before school starts. Right. When we come back from the break, Annette will explain to us the benefits of that, and I know that will be huge, not just for the employees, but also for the students. You're listening to the JMCSS podcast for the district on JJ 97.7 FM.
Hi, I'm Terica Smith, a local attorney and proud JMCSS graduate, but I'm also a JMCSS parent. We chose Jackson-Madison County Schools for educational options that are innovative and challenging. Whether it's the Academic Academy at Northeast or early college and career opportunities at JCM Early College High, JMCSS offers classes and programs that will prepare my son for college and beyond. Plus, JMCSS is a Level 5 district and tuition free. It just makes sense.
Hi, I'm Greg Hammond.
Chief of Public Information for the Jackson-Madison County School System. With an increased focus in the fine arts, athletics, workforce development, and early career opportunities for students, there's never been a better time to choose us. Tuition-free Jackson-Madison County Schools. Visit jmcss.org today to schedule a tour or call 731-345-7011.
Hello, I'm Elias, a star student at Arlington Elementary School. You're watching For the District. Now back to the show.
Welcome back to the JMCSS podcast for the district. I'm Greg Hammond, Chief of Public Information, and I am visiting with two very important people. Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and Latreace Brown, Clinic Manager with West Tennessee Medical Group. Before we get to the services offered at the school health clinic, which will open July 18th, Annette, I'm sitting here thinking, a year ago, 2 years ago, so much of both of our time was just tracking COVID stats.
Yes.
Wow, does it feel good to kind of have that behind us and be on the other side of that? Put into words what the last 2 years were like for you, because you're one of those frontline people that, helped lead the way.
Oh, there's so many emotions. I'm just thankful that it's behind us, and I'm thankful that we're on the other side, and that we can now think about positive things. And that was a scary time and uncertain. It was territory that education or healthcare had ventured through before in our lifetime. So I'm so thankful. I'm thankful to be a part of it, but I'm so thankful it's behind us. Yeah, I know you are.
I am. But also folks that walked alongside us, our community partners in West Tennessee Healthcare, West Tennessee Medical Group now. How important is it for us now, Annette, to change our thinking? And I'm speaking for the average Joes here. Change our thinking in terms of health and wellness, because I guess the average Joe doesn't think about necessarily health until they get sick.
Right.
Talk about how this whole conversation, and particularly what the superintendent has been talking about lately, thinking about health and wellness, how important is it for us to kind of change our thinking in that and not be so reactive, but maybe preventative?
Right. And we learned that. I think it's something with coordinated school health. Staff wellness has always, and health education has always been one of our target areas. But I think one of the things that we learned from that is that we need to take care of ourselves, and whether that's with immunizations, well adult visits. Most people as adults only go when they're sick. Yeah. So we need to get away from that and start doing more preventative care and taking care of ourselves. And that's not just your physical health, but your social and emotional health. So I'm really excited to see what's on the horizon for us with Jackson-Madison County Schools and working on that staff wellness piece. I told Dr. King I'm very excited about that.
So just to kind of let you behind the curtain a little bit, this past week we had a school board meetings, and Dr. King's been laying out some of his new ideas, the vision he has set for 2024. And much of that conversation has been about employee benefits in the area of health and wellness. And so it's very exciting stuff, but it's also that encouragement, reminding our teachers that they can't take care of their students
if they don't take care of themselves.
And
that's important. We know healthy students make better learners, but we need our staff to be healthy. And that's all staff, not just teachers. We need our bus drivers to be healthy, our cafeteria workers, our nurses. And I think that during COVID, a lot of people started to think a little bit more about, if I'm a healthier person, if I do get sick, and I have a good support system and have a primary care physician or somewhere to turn to, you have a little less anxiety because you've got somebody that can help care for you.
Latreace, so Jackson-Madison County Schools will be the third school health clinic that you'll help oversee. When you talk to school employees and when you talk to families, what is the conversation? How do you convince people to care before it's too late. This idea of preventative health.
That goes back to the education piece. A lot of times people are more open to when you share stories regarding it. With that being said, you give them an example why this is important. By working in public health, I worked in public health with the health department for 14 years. So the education is there, just presenting it. So making it known how important the shots are, how important their health is, like Annette said, for the parents to be able to return to work. Because, hey, if your child is sick, you got to stay at home.
That's right.
But, letting them know how important it is to be proactive, doing things before. So just being out there, being that face, giving that education piece, and just taking the time out to talk with them. And,
Latreace Brown with West Tennessee Medical Group. You'll help oversee, you already oversee several school health clinics. You'll help oversee ours as well. Annette Wilson, the coordinated school health administrator. Annette, you've been excited. She's been excited, and the more I learn, the more excited I get. Our school clinic is reopening.
Yes.
But also the fact it's going to reopen 2 weeks before school starts back.
Yes.
Talk about the advantages of that, Annette.
The advantages of that is that parents can get their child in and get the required immunizations, school physicals, if any student needs a sports physical. Also, if we've got any bus drivers that need their DOT physicals, that is a new piece that we're adding to the school health clinic, which is a benefit for our staff. So by opening early, it gives us a head start because we really like for our students to have everything, from pre-K all the way up. If they need immunizations or a well-child exam, we can do it.
And we'll also help some procrastinators if they're seniors heading into college and there are these health requirements that they have to get done. Although technically they would have graduated, that support is still there to assist them as they prepare to go to college.
Yeah. If we've got a senior that, we'll just use, some of these seniors that are graduating next week.
Right.
If they need some vaccines, let's just say the meningitis vaccine before they go off to school, in August when the clinic opens, they will still be able to come in and access those services and get vaccines done.
Also, another important piece to reiterate, the idea that we understand that in the Jackson-Madison County school system, we serve a diverse population of students and families. And the fact that, number one, all insurances are accepted.
Yes.
Number two, for those families who may struggle paying that fee, it's very affordable, and really we understand as a system that we need to be there for all families. Can either of you speak to that?
Yeah, we both can, but I will say that, we want to meet our families where their greatest need is. And so if they're uninsured or underinsured, we'll do like we did before, put them on a very reduced fee for those services. And we even have an arrangement to work with our homeless population. So any of our students that need those services won't be turned away.
Again, I think it's important to remember when folks think about school, they think about homework and test scores. And we're so much more than that.
Oh, most
and
definitely.
our school health clinic is a reminder of that. And the idea that if the kids aren't healthy, they can't be in class and they're not learning. And so providing that health piece to not only keep the kids healthy, but also the employees is amazing. Real quick, before we go to our next commercial break, Annette, the grand opening for our school health clinic, which had been around since 2009. So July
The 18th.
July 18th, the school health clinic returns. An exciting time in the Jackson-Madison County school system. We'll take a quick time out, but don't go anywhere. We'll continue our conversation on health and wellness in the Jackson-Madison County school system. You're listening to For the District on JJ 97.7 FM.
Hi, I'm Tad Pohl, host of the Morning Splash on Froggy 104, and a proud JMCSS parent. My wife and I chose Jackson-Madison County Schools for our kids. Brooklyn is an honor roll student who has found an aptitude for art and is also a member of her school choir. And the twins are getting excellent instruction in pre-K and learning valuable social skills. The kids love their schools and their teachers, and we are very proud to be JMCSS parents. Jackson-Madison County School System is a Level 5 district and tuition free. It just makes sense.
Hi, I'm Greg Hammond, Chief of Public Information for the Jackson-Madison County School System. With an increased focus in the fine arts, athletics, workforce development, and early career opportunities for students, there's never been a better time to choose us. Tuition-free Jackson-Madison County Schools. Visit jmcss.org today to schedule a tour or call 731-345-7011.
I'm Nixie.
And I'm Annie. And you're watching For the District. Now back to the show.
Welcome back to the JMCSS podcast for the district on JJ 97.7 FM. We're visiting with Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and our new community partner, Latreace Brown, Clinic Manager with West Tennessee Medical Group. If you're just now tuning in, you'll be excited to know our school health clinic will reopen in July. Yes. And so our school health clinic ran from 2009 up until 2020. Mm-hmm. And so we're so excited to have it back because of that. This is a benefit to not only our students, but also our, and I was going to say teachers, but all employees.
All employees and their immediate families.
Wow. That's awesome. Mm-hmm. And so communication is important so people know about it, but then that education piece with the health and wellness, so very important. Latreace Brown, Clinic Manager with West Tennessee Medical Group. The Facebook page for the health clinic is already up and running, and so folks can learn a little bit more about the staff there. Tell us about that.
Okay, so the Facebook page is already running, and it's under Jackson-Madison County School Clinic. With that, we're going to share different information that's coming up that patients will know when we have upcoming events. And we're good in the community at showing up. So you may look out and see us set up with our booth, with our swag, passing out stuff regarding this clinic. But it gives you a brief description of Ashley Hardy, who's our nurse practitioner.
Awesome. And
then also it'll have our hours, order of operation, all of that. Anything that's related to the school, it'll be on that Facebook page.
Very good. We are so grateful for our community partners because they really help us get the job done. Really, I was going to say on things outside the classroom, but even in the academic piece, community partners like West Tennessee, the United Way and West Tennessee Healthcare have been very instrumental. Another community partner, Annette, that I just learned about recently, Friends of Heart.
Right.
We already have a success story with the EKG exams. First of all, folks on the radio may not know what EKG is. EKG is because I didn't know up until a few months ago. So first, talk about what the EKG is and then why that was beneficial for our athletes.
Well, as many people know, there's been a lot in the media after the NFL player that took the hit. And then there's been some students that have had some bad outcomes because they had an unidentified cardiac condition. And so an EKG is just a simple test that they can look at the heart and by it's non-invasive, just putting the leads on and running the EKG.
So you mean you're not going to stick me and it's not going to hurt?
No, it's just little stickers. And so, and that's what we had to tell our students. Yeah. There's no needles. So we partnered with Friends of Heart. We had tried this pre-COVID to make it all work, and it didn't happen. So now that, like I said, that's in the rearview mirror, we're moving forward with prevention. And so we started with Northside as a pilot program, and we did 116 EKGs. We had approximately about 6 students that were flagged as we might need to take another look at. Mm-hmm. All of those students were seen by a LeBonner pediatric cardiologist, thanks to Dr. Mike Revel in the ER at Jackson General. He has been huge with helping this project. The students, those students that were seen have been cleared.
Awesome.
To now move on and participate. So this is very important. It's a great way to give parents a peace of mind that, because they can go for a sports physical, but that's not a normal part of it. It's not normal to do an EKG on a child unless there's some history there or they're having symptoms of a regular heartbeat or just something that is picked up by their primary care. So I've had many parents call me and say thank you and thanks to West Tennessee Healthcare Friends of Heart for helping with this service. So we're excited. We're planning to go to all the high schools next year. We've got all the kinks worked out of this, and it was a great resource for our students and their families.
On the health and wellness side, another community partner that comes to mind is West Tennessee Bone and Joint.
Yes.
Particularly, you get into the summer season, your athletes, middle school and high school, preparing for sports, and that West Tennessee Bone and Joint really offers an awesome service. Tell us about that.
West Tennessee Bone and Joint, for many, many years, has offered free sports physicals for our high school athletes, not middle, but high school. And they do a great job with coordinating dates. They work with the sports trainers through West Tennessee Healthcare, as well as all of our athletic directors at the high schools, so parents know this is the date that my child can go and participate in a free physical or sports physical. And so that's a great service. I think a lot of people in the community may not realize we have a lot of great partners, and that's one I think that has really not gotten the credit. So thanks so much to all those physicians out there, and they also serve as team docs for our sports teams, and that's huge as well. So thank you to them. We are so blessed in this community.
Say it again.
We are.
Because we are, yeah.
We are so blessed. I mean, even thinking back through, and I know we hate to keep going back, but we had so many partners from the health department, from UT Family Practice Docs, Dr. Ellie Riley, I think is her last name. I may not should have said that because I may be wrong. But we had so many partners through everything, and we're so blessed because we couldn't educate our kids alone. And we know, as I've said before, healthy students make better learners.
Yeah.
And so whatever we can do to make them be successful in the classroom or on the field or on the court is what we need to be doing.
And healthy teachers make better educators. So
Yes.
we are excited about the reopening of the school health clinic. It will reopen on July 18th. That's 2 weeks before school starts. And so these services we certainly want our parents to know about for our students, but also we want our employees to know about so they can also prepare to have a healthy and successful school year. We're visiting with Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and Latreace Brown, Clinic Manager with West Tennessee Medical Group. Why do you do it? It's hard work. And so I have to ask, and I ask our principals this, education is hard work. Certainly healthcare is hard work when you're working with the community. And a lot of times you have to encourage us to care more than we do, right? Because we need to be health conscious. We need to be worried about our health and wellness. So as two veteran healthcare workers, Annette, why do you do it?
For the kids. Every day, I tell our staff, and we've got about 32 people in our department, I'll say, never lose sight of that child. If you do, you've lost your vision. So every day, that's the goal. And when you go out into the schools and you see those children, and even if you're in the high school and see those big kids that are not so little, and you see them being able to be at school, be healthy, be out on the court or on the baseball field or on the, playing football, whatever they're doing. It just brings me joy to know that we have a part in them being successful. The school nurses do an amazing job, and you've heard me say it so many times. I mean, we have more school nurses than we've ever had. And
No, Annette, if you would say that again.
We have more school nurses than we have ever had. And, that's the silver lining, too, of COVID, is because it brought their service. They've always been behind the curtain, just really. And I think a lot of people don't realize, and our data shows that about 85% of the time, if the student sees the school nurse, that child returns to class. If there's not a nurse in the building, most of the time they go to the office, they go home. And so our nurses know our children. They know our frequent flyers. They know who is really sick and who's playing, maybe needing to get out of that same class every day that they come to, and they return them back to that class. So we couldn't do what we do without our nurses as well. And today is National School Nurse Day. So
as of this recording.
Yes. Yes, as of this recording. And so our nurses go above and beyond every day. So I can't sing their praises enough either.
Latreace, I have to ask you, clinic manager with West Tennessee Medical Group, you oversee a lot of school clinics. We know it's hard work. Why do you do what you do?
Like Annette said, because you care. We can't forget, they are our future, okay? So we want to, instill in them how important health is, so one day they will go out in the community and do the same thing.
Yeah.
So, hey, if they see us caring, hey, we're just going to spread the love and make it share with them. So, ultimately, because we care. And like she said, it's nothing to see that face coming up to you, hugging you, or like you said, that person being taller than you, but because we care.
Yeah. Something that if you follow us on social media, you see a lot, the hashtag winning. And, when we hear that we've had more nurses than we ever had, in previous episodes, when we hear that every school now has an art teacher dedicated to that school, has a choir teacher dedicated to that school, allowing these students not only to stay healthy, but finding these activities that give them joy and keep them engaged in the classroom. So we certainly want to thank our superintendent, Dr. Marlon King, for his leadership, our school board, who's been very supportive all the way through, our teachers, our support staff, our bus drivers, our cafeteria workers. It really takes a team.
It does.
And if we're winning, it's because all team members are playing their role and doing their part. And so conversations like this just remind us that not only are we doing the job, but we have helpful and supportive community partners who help us get the job done. Annette, thank you for what you do for our school system, and thank you for being here.
Thank you for having me.
Latreace, it was nice to meet you.
Nice to meet you.
I look forward to seeing you around more now that this community partnership has rekindled.
Of course.
You've been listening to For the District, the JMCSS podcast. We again want to thank Annette Wilson, the Coordinated School Health Administrator for Jackson-Madison County Schools, and Latreace Brown, Clinic Manager with West Tennessee Medical Group. In the event you caught this conversation midstream or you tuned in late, want to remind you, you can catch the Jackson-Madison County School System podcast right here with Forever Communications, JJ 97.7 FM. You can also check it out on demand, Apple iTunes, Google Podcasts, Spotify, wherever you check out your favorite podcasts. And our friends at E+ TV6 will play these podcasts as well. I'm Greg Hammond saying thank you for joining us. We hope you have a great Sunday and an excellent week. We'll see you next time.